South African officials have identified quarantine sites as the country prepares to go into a 21-day lockdown from midnight on Thursday. Now, the number of confirmed coronavirus cases has risen to 709. The country's health minister has warned infections will keep rising. All right, for more on lockdown preparations, let's cross over to Johannesburg, where we're now joined by Ntshepeng Motema. Ntshepeng, so we're about 12 hours out before a 3-week national lockdown goes into effect in the country. Tell us what the mood is there.
Well, it's actually been slowing down in many ways, particularly in the inner city. The usual hustle and bustle, traders everywhere, people walking all over the streets, trying to earn a living, shopping. That is slowing down. What has been happening, places that have been busy are bus stations for long distance travel. A lot of people are packing their bags and are going out of the city of Johannesburg or the province of Gauteng, because a lot of people who come into this province are people who come here for economic opportunities. And now many people say that if I'm somebody who works today, to get paid to buy food or get paid weekly during the lockdown, I won't be able to do that. It's just better that I pack my things and go back to the village, go back to the small town where they could be with their parents, who right now is harvest season, so there's food in the villages. But the government says, no, don't do that, because the very people that you're saying you're going to are elderly and have other health conditions, which makes them vulnerable. Because a lot of people haven't been tested, that there's a likelihood that you might have contracted the virus, and now you're taking it to smaller towns, to villages, places that will not be able to cope when it comes to treating, testing people, because the health system is very fragile in those places. Even here in big cities, that is the case.
Okay, so South Africa's government will basically come out and say that we're taking this seriously and that they're taking steps to sort of flatten the curve. Just give us a quick roundup in terms of what the situation is like in other countries on the continent.
Other countries too have been reacting. They've put out measures. There's curfews in a number of countries, such as Tunisia and Mauritius. There's lockdowns in Rwanda. A lot of countries are acting. With Namibia, actually, which is one of the neighboring countries to South Africa, what they've done is they are reconnecting water supplies to homes, properties that have been defaulting, people who haven't been paying their bills, because people need to practice a healthy hygiene. People need to wash their hands. So that is what is happening in Namibia. And also closer to home in Zimbabwe, there is actually a worrying thing. The government says that they're acting, but the worrying thing is that doctors and nurses are going on strike. They're saying that effective immediately, they'll stop working because they fear for their lives. There's no protective gear at all, and they've been raising their concerns, but no one is able to answer them in a way that is satisfactory to them.
All right, South Africa preparing to go into a 21-day lockdown. Ntshepeng Motema, live for us in Johannesburg. Thank you.